when a deadly plague hit Roman Naples in 1656. In order to stop the devastation that always comes with plagues, plague doctors arrived to treat the diseased. But in order to stop what they believed to be the toxic air from affecting them, they wore a thick waxed coat and a mask with a long beak. Most people found the sight of them terrifying. The costume was creepy in its own right, but what's worse is that if the plague doctors had arrived, so had the plague. The beak doctors did the best they could to stop the disease. One of the methods used to protect themselves from the disease was to use a stick instead of their hands when interacting with patients. The costume was invented by a French doctor called Charles Delorme in 1619. The beak was filled with dry flowers, herbs and spices to protect them from the bad air. It was found that doctors who wore this costume wouldn't catch the plague. This is because they were protected from head to toe, making it hard for fleas to find their skin. Plague doctors weren't always qualified, and becoming one was quite easy. This is because of the obvious danger of the job. Very few people were willing to risk catching the plague. The result of this is that almost anyone willing to become a plague doctor could. Plague doctors were normally paid very well, because of the obvious danger of the position. People in desperate situations were often willing to try anything. The doctors would often exploit this desperation in order to gain as much money from them as they could. There isn't much evidence to say that the plague doctors really ever did much to help the situation. They would be used to determine if the plague was in a certain area, but they never came up with a cure. This is partly because they couldn't get past the belief that bad air was the cause of the plague. Real doctors would normally flee the area when the plague hit, and the unqualified physicians who took their place sometimes would even die before their patient did. This is something that called the effectiveness of the beak doctor's uniform into question. Plague doctors had a variety of methods to try and cure the disease. These included cooked onions, 10-year-old treacle, sitting in a room between two large fires, sitting in the sewers, and flagellating themselves to gain God's forgiveness. These treatments were never effective in curing the disease, but considering that a victim of the bubonic plague had a 50% chance of survival, it may have appeared as if these treatments were more effective than they really were. One valuable contribution they did make was to record the amount of deaths due to the plague in public records. Real doctors normally would just abandon the area once the plague started to take root. This seems strange at first, for doctors to abandon people in need. But considering what we're about to see, it's easy to understand why. The Black Death struck Naples in January 1656. Dr. Giuseppe Bizzuto announced that the plague had arrived that month. He did so after examining a Spanish soldier and recognizing his symptoms. You would expect that he would be lauded for discovering disease before it could spread too far. The government was infuriated and sent him to prison for spreading news of the plague. They wanted and tried to cover it up, but they couldn't stop the news from leaking out. People had already begun fleeing the city, and in only a few months, 300,000 people had died. In the end, the government was forced to admit that the outbreak had actually happened. The plague is caused by a bacteria called Yersinia pestis, which is found in rats and fleas who feed on rats. Humans can contract the disease from flea or rat bites. If you're unlucky enough to catch the bubonic plague, you'll start to see symptoms in around 3 to 7 days. Lymph nodes would start to appear on your body, and you would experience chills, fevers, and headaches. Your best chance of survival was for the node to burst on its own, but the mortality rate was 50%. Although bubonic plague was bad enough, septicemic plague was even worse. This form of the plague affected your lungs and had a 90% mortality rate. But even this isn't as bad as pneumonic plague, which had a mortality rate of 100%, as well as the most painful symptoms. These symptoms being chest pain, fever, chills, nausea, vomiting, diarrhea, and shortness of breath. The service plague doctors provided was questionable, but they are a fascinating and creepy part of history. The plague doctors began to disappear as the plague died out in Europe and they became unnecessary.